Say hello to Jessica. Jessica is a 20-year-old international student and it is her first time in Europe. You can imagine that it must be quite nerve-wracking being in a new country outside everything she is familiar with. Her new university is bringing her some anxiety, and on top of that, she has exams approaching throughout the year, in addition to the stress she already has. Jessica doesn't want to worry her family and tells them everything is okay. She is also struggling with finding friends in her new city. She finds she also has trouble sleeping, eating, and focusing on reading. You can imagine she is feeling distressed and overwhelmed. The next morning, she wakes up feeling strange and in acute fear. She notices her heart is beating fast and she is sweating and shaking. She had no idea what was happening. She thought she was going to die. Jessica has had a panic attack. She is extremely scared about what she should do since she doesn't have a GP. Her nearest GP practice was full and were not accepting new patients. We can characterize Jessica's health condition as a mental health problem. And so, what is mental health? Mental health is influenced by our emotional, psychological, and social well being. Our mental health affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make life choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood, and it is more than just the absence of mental illness. It includes how you feel about yourself too. Over the course of your life, if you experience mental health problems, your thinking, mood, and behaviour could be affected also. This is a table showing 10 characteristics of mentally healthy people, as stated by the National Mental Health Association, and feel free to refer to this table. However, it is really important you are aware that no one possesses all these characteristics all the time. That would mean that everyone has perfect mental health, which we know is not possible being human. How do you access help? First and most important, if you are in a mental health crisis, please dial 113 and you will be helped immediately. If you are not in a mental health crisis, you can call your current health insurance company to make sure mental health services are covered, and then you can contact your GP and they can refer you directly to primary or secondary care. Here are the differences between primary care and secondary care. Primary care is for mild to moderate mental health issues. You may be referred to a social worker or a psychologist from the municipal mental health services. The treatment may consist of counselling from a psychologist or psychotherapist or some form of online mental health support. It could also be a combination of both counselling and online support. This is about quick and short-term help around 10 to 12 therapeutic sessions. Hopefully there will not be a long waiting list, although it is the norm in the Netherlands. Secondary care is for patients with serious and complex psychiatric disorders. It could come in the form of specialised care and diagnosis in hospitals and other facilities. Unlike a psychologist in primary care, a psychiatrist will be able to prescribe medication if needed. If you are under treatment in primary care, you may need one or several treatments with a secondary care professional to get a diagnosis. Once they have worked out a treatment plan, your psychologist will be able to continue treatment with you. If you cannot get a local GP or the waiting lists are too long, contact us at HelloDoc. One of our doctors will refer you to our psychologist on board. You will be able to schedule a first intake within a week at most. During the intake, your psychological concerns will be addressed and a rapid will be established. Working with a psychologist is delicate and confidential. Our two psychologists are registered at the NIP. It is our practice that we always give the chance to the patient to decide whether the psychologist is fit for their needs. What can you expect from the psychologists at HelloDoc? Typically, we work between primary and secondary care, and we have a multidisciplinary approach providing blended care. You can expect to have short duration therapy between 5 to 7 sessions for mild symptoms and 8 to 12 for more severe cases or where psychological traumas are present. Our team has developed e-health packages and provides them with the guidance of one of our psychologists. To give an example, let's go back to Jessica. Our psychologist will provide Jessica with a safe place for validation of feelings and experiences. In this stage, Jessica and her psychologist will develop a relationship. In the next step, Jessica will receive psychoeducation on what is a panic attack and what to expect. She and her therapist will work together to develop a shared understanding of her story and circumstance. Unmet emotional needs and beliefs that were formed in childhood will be addressed. Jessica will learn to recognize unhelpful coping styles and their consequences in her life. Therefore, the student will develop understanding towards her thoughts, fears, and anxiety levels that might have caused her to experience these panic attacks in the first place. Examples of intervention techniques are cognitive behavioral techniques and experiential techniques. Cognitive behavioral techniques aim to help you challenge your beliefs and develop healthier patterns of thinking towards oneself and the world. Experiential techniques are techniques such as imagery, chairwork, and role playing in session that target painful emotions and patterns. In therapy, we work together to accept of what is, incorporating mindfulness and commitment to acceptance. Your relationship with a therapist is used as a platform for healing and developing self compassion and developing more flexible responses to triggers or events. The overall goal is to give Jessica the tools she needs in case she encounters other panic attacks in the future, so she can manage and cope on her own. It is important to say that this process might not always be easy, as sometimes in therapy one needs to speak about painful experiences. This work is necessary in order to reprocess, accept, and grow. Say bye to Jessica now. This week is her final session and already feels a whole lot better. Although HelloDoc is an online clinic, you do have the possibility to see your psychologist face to face, especially with more complex cases. You can make an appointment with one of our health professionals by making an account at www.hellodoc.nl. We are accessible 24/7 online and on weekdays for scheduled appointments in various locations throughout the Netherlands.